when young people are not just included but intentionally empowered to live.
What WHO means to me, what the World Health Organization means to me is a lot, because they're an organization that sees to cater for human health and ensure that the general population of the world is doing well health-wise, because health is wealth, and without our health we really cannot do much.
What is WHO to me? WHO is actually equity and global solidarity in health, in helping the marginalized community access better health and reach all the health gaps that we have.
I see the WHO as the seat of leadership in global health and health equity and also evidence-driven impact. WHO reflects how that when science, policy, and collaboration work together, then we can solve real health challenges.
And WHO to me, as a medical student, while I was still in school, WHO was just the means of me getting information regarding health conditions, health issues, their prevalences, and things about them.
World Health Organization represents global leadership in health equity and evidence-based action. It is a symbol of collaboration across nations to protect and improve lives.
The World Health Organization is committed to global health equity, collaboration, and evidence-based solutions, which are values that align with my vision for future health.
And what WHO means to me, it feels like a place where I belong. Seeing my career path, WHO will be a great opportunity for me to experience public health challenges firsthand, and then to get involved in the solutions that will help society in terms of health-related topics.
Youth empowerment means a lot to me because it means actively involving young people in decisions, activities, and actions that affect their lives. It's about having a voice, being listened to, and taking part, not just being told what to do. The training means a lot to me because it means I'm having the opportunity to speak up, contribute ideas, and take action in so many stuff.
This engagement means shared responsibility. It means recognizing that young people bring experience, innovation, and bold ideas to global health challenges. This training is important to me because I want to better understand how to contribute meaningfully to global health platform and ensure that youth perspective provides a sustainable solution to health.
What youth engagement means to me in this training particularly is that WHO partnering with SDSN is coming together to ensure that youths have specific knowledge on certain things like community health, things that maybe challenges we face as youth, such as mental health issues, teenage pregnancies, global health, and all of that.
Youth engagement means giving young professionals real responsibility in shaping the health solutions. It's not just about participation, it's about contribution. This training matters to me because it creates the space to learn, collaborate, and develop practical skills that can translate into action.
This mission to fostering accessible healthcare across the nations stands strongly with my passion to serving humanity. This training has an opportunity to connect with like-minded individuals, collaborate with other young leaders, and to contribute greatly to the global health at large.
Youth empowerment to me means building capacities, creating opportunities, and allowing young people to lead change. Not just preparing them for the future, but empowering them in the present. This opportunity is important to me because it provides me the knowledge, the exposure, and the network in order to become professional health worker and a future leader. Thank you again for this opportunity.
I would use this as an opportunity to enlighten the youth on how to take care of their health and how to become a healthier person.
I see that youth engagements like this training are very important because young professionals are not just the future of health systems. I would say we are already contributing to health systems.
Youth engagement is important to me because young people are not just the future, we are part of the present. I believe engaging young people tends to build leaders who understand their communities and are ready to act. This training is important to me because I feel it's going to help me strengthen my skills, confidence, and understanding of the global health network. Thank you for this opportunity and have a good day. Bye.
All right. Thank you for the video technical team. So allow me to introduce myself again. I'm Fawaz Abdulaziz, and I'll be co-moderating day two of this session with Oluwatosin. To get things rolling, we are going to release an icebreaker in the chats. So please keep an eye on the chats right now. We're releasing the icebreaker, and we would like everybody to be as honest as possible in answering these questions. These are just questions to get this session started. And yes, so the icebreaker should be in the chats now. Oh, thank you for that. So as I was saying, our questions will be released by a poll in the chat. So please ensure to participate by taking the poll. In the meantime, I'm going to read out the questions now so we can all participate. And the first question we have is, what global health challenge are you most passionate about solving? A, climate change and environmental health. B, access to quality healthcare. C, education and skills development. D, inequality and social justice. And E, some other goal.
Okay, I'm seeing a lot
Question
of B's
two
and A's.
is, oh yes, thank you for that, Oluwatosin. Question two, we have, what is one barrier preventing youth from driving change? A, lack of opportunities or lack of access to resources. B, limited mentorship or guidance. C, insufficient knowledge or skills. D, low youth representation in decision making. And E, some other challenge. Well, to be honest, there are no wrong answers here. So everyone can continue to participate. Well, I guess we've had enough icebreaker questions. Moving on, I'll be introducing our speaker, Doreen van der Waal, who will be walking us through careers in global health. With the World Health Organization since 1989 and has contributed to multiple departments at the WHO, including the expanded program on immunization, the offices of Directors General, Gro Harlem Brundtland and John Wook Lee. She's also contributed at the Health and Multilateral Partnerships, and currently she's at the Partnerships and Finance departments. Since 2010, Doreen has led the WHO Briefing Center, which engages thousands of students, professional association members, and public health practitioners each year. The center offers a window into the multifaceted work of the WHO, connecting current and global future health actors with WHO experts through experts briefings and interactive sessions. Doreen believes that engaging young people is not a token of gesture, but a strategic necessity. To quote her, she says, their ideas, skills, creativity, and commitment are essential to shaping policies and programs that improve health and well-being worldwide, ensuring global health initiatives are responsive, forward-looking, and fully equipped to meet the challenges of today and tomorrow. And therefore, I am honored to reintroduce our speaker for today, Doreen van der Waal.
Thank you very much for the introduction, and it is indeed a real honor to be here tonight with you. There is a large number of people that have joined us tonight, and I'm going to speed up a little bit so we have also enough time for questions and answers. But first of all, youth engagement is essential. I've been working at the UN. The WHO is part of the United Nations. It's a technical agency that works in global health. And I've been working almost 38 years at WHO. And thanks to Dr. Tedros, our Director General, who really believed that we need to bring in young people in the global health spaces. It is time we do that. And thanks to him, we have been able to actually set up youth initiatives that allow this to happen. When we talk about youth engagement, it's not just about bringing people in where the decisions are made. It's also to bring young people in where decisions are made. It is to bring young people in where technical guidance is created, where technical documents are created. But we also need to be able to connect with young people in communities, because young people are very strong partners in communities. So there's different ways as young people that you could see yourself when we talk about youth engagement. So one of the initiatives that we've started is the WHO Youth Council. And the WHO Youth Council, I know there's a lot of people on the call that are part of a youth organization. The WHO Youth Council is it is a council of 25 youth organizations that serve for 2 years and that get re-elected every 2 years. New youth organizations come in. Now you would probably say, well, what are the chances that my youth organization actually possibly gets into this youth council? Well, I'm very happy that I have a colleague actually from your country, Mayowa, a colleague that has joined the Youth Council from the Africa Public Health Student Networks Initiative. And he's a very committed and a very passionate member in the WHO Youth Council that I've come to know. And he's going to give you a testimony that it is possible to be part of about the initiatives that we have at WHO. So the Youth Council, these are all young people that represent youth organizations that actually advise our Director General, Dr. Tedros, about issues that are important for them. And they will provide advice. They will say what we do well at WHO and what we should do better and what we don't do well. And they also have specific asks. And the specific asks are things like, how can we bring more people into the workforce at WHO? If you look at the statistics, there are not enough young people working at WHO. We need to change this. This is part of my work, is making sure that we bring young people into the global health spaces in different areas, but also looking for opportunities to bring more young people into WHO, into the WHO workforce. We have another youth initiative that it has more an educational focus, and this actually webinar all started because of this. It started with one of your colleagues, Faridat, who actually set this all up with other colleagues, who set this webinar up. That came to Geneva last year October, to join the Global Model WHO, which is a youth conference where we had 450 people that joined from all over the world. And it was their time to actually negotiate as countries, as member countries of WHO. Farida, we selected her also to be part of a very small team to work on a youth initiative on a youth declaration on social connection. So she, for me, Farida, is one of the most perfect examples of somebody who dared to come to Geneva to register herself and took back a lot of these things back to Nigeria. And actually now we're sharing things, actually thanks to her coming to Geneva and being and us meeting up. So the Global Model WHO is a conference that we do it yearly. And we're right now also looking at doing a regional Model WHO in China. And this is something, if we could at some point in time think of doing a regional Model WHO in Africa or in one specific country, maybe even Nigeria, it would be absolutely wonderful. We have another way where we want to make sure that young people have their voices heard. And somebody in one of the testimonies said, young people are not just the future. Young people are also the present. So what we're doing at WHO, we work with member states, with member countries, and we ask them to join what we call the WHO Youth Delegate Program. So part of the work at WHO, we work with member states. Member states come regularly to WHO for meetings. And what we want is the member states bring systematically young people as part of their delegations in order to have their voices heard. Now, to go a little bit into careers, because I know a lot of you are thinking, well, would I have a chance one day to actually find myself in Geneva at an organization like WHO? Now, WHO has a headquarters in Geneva, but we also have 150 country offices where there's also possibilities for Nigerian nationals to apply for jobs. We also have 6 regional offices. And so this is the structure of WHO. And so when we talk about career opportunities, this will actually go across all the 3 levels of the organization. Now, what are the typical talent programs that we have for young people? So we have a JPO program, which is called the Junior Professional Officer Program. And I will, when my colleague is taking over, I will put this all in the chat and in the Q&A if needed. The Junior Professional Officer Program is a program whereby countries sponsor positions within WHO departments. They're directly paid by the government. And the nationals of those member countries that actually are part of this JPO program, Junior Professional Officer Program, can apply for positions. Now, you'd say this is a very privileged program because it basically means only the nationals that are, only the countries that are participating in this would benefit from this. But there are several countries that actually open their positions to other countries as well, and mostly low and middle income countries. Some of the countries that open these positions up to these countries are the Netherlands, it's Italy, it's Belgium, it's Switzerland. Spain has also opened up positions to candidates from other countries. Sweden, and I believe Germany has also opened up positions in order to make sure that we bring in youth also from other countries, and it's not always the same privileged countries that participate in this program. Then we have an internship program. The internship program is a paid program. In the past, and a lot of United UN organizations don't have paid internships, which again means that it's only people from privileged backgrounds and that can actually access these programs. So Dr. Tedros, when he was elected, he immediately wanted to change that. And actually, when interns come, they get a stipend, so they can actually, when they come to Geneva, they can get by. They get actually enough money to be able to stay and to pay for their living. The internship, and also because of this, it means people from everywhere in the world, from all of the countries, have access to become an intern. So at WHO, there's a lot of sensitivity of being inclusive, of making sure we have geographical balance, making sure that all countries are well, that have access to be part of the global health workforce. We have also, Dr. Tedros opened, I think it was just after COVID, a young professional program. This program was specially designed to bring young professionals in from different backgrounds to work on positions. I believe they were 2-year positions. And this program was designed for low and middle income countries or least developed countries. We are also with the WHO Youth Council thinking of more creative initiatives. How can we bring in and how can we make universities work together? So we have created a concept which is called the WHO Youth Fellowship Towards Equities. What does this mean? It is working with universities that have the means to bring fellows to WHO. But when they want to work with us and bring fellows to WHO to work on a specific topic in a technical department, we would like them to pay 2 fellows from low or middle income countries to join those 2 fellows from their university and create a network between the 2 universities. And when the people come and work as a team in Geneva, they will be mentored and they will all work on a specific project to make sure that they can provide their views and their expertise as young people. And at the same time, it allows us to do capacity building and it allows us also to mentor them. This program is not launched currently, but we're looking at putting all the modalities in place. But these are more or less the programs that we have. Now, I'm going to stop here because we're running out of time. There's one thing I wanted to say as well. LinkedIn is a very powerful tool. I see a lot of the people already putting LinkedIn into the chat and sharing that. It's the same, a lot of WHO positions, consultancies, internships, they're always advertised on LinkedIn. And my personal capacity on LinkedIn, I post as much as possibilities that I can for young people. And that means possibilities to join specific programs in the UN or WHO or other UN organizations. So I'm trying to give visibility to these possibilities for young people to join. I'm going to stop here, and I don't know if Mayoa is going to take over from here. I will go through the Q&A, and I will also try and address as many responses that I can in the meantime. Thank you.
Thank you so much, Jory, for that. I hope we've all heard that LinkedIn is a very powerful tool. So for those that don't have LinkedIn yet, please do set up your profile and you can follow Jory on LinkedIn to get as many opportunities as possible. Okay, so moving forward, we are now diving into the journey of a global health leader. So most of us here are medical students or students doing science-related courses. And I'm very sure we'll be healthcare professionals next few months or next few years. And most of us are wondering how we can actually start, building our career right now. So to help us answer that over the next, few minutes, we'll be listening to a medical doctor who is already at that stage. He is a member of the WHO Youth Council, where he advises the WHO Director General and the senior leadership. He is a part of the UNICEF Generation Unlimited Niger task force aimed at equipping 20 million Nigerian youth with skills and opportunities for impact. As the chairperson of the African Youth Antimicrobial Resistance and Alliance Task Force, he leads a collective voice of over 600,000 youth and champions mitigation efforts against AMR with React Africa, Africa CDC, and the UN quadripartite. He is deeply committed to the SDGs and the African Union's Agenda 2063 and advocates for sustainable and youth-centered health solutions. So we are honored to have him share his journey and give us practical insights and lessons that he has learned throughout his career. Please join me in welcoming Dr. Akinpelu Maiwa.
Hello, everyone. I hope I'm audible.
Yes, you're audible.
Thank you very much. Thank you once again. It's actually a big pleasure to be part of this very important discussion. It's also interesting to be amidst so many enthusiastic, brilliant minds who are interested in taking over the public health space in the future. And I think this session for me, I felt it was important for me to go a very dynamic approach rather than doing the whole presentation. I felt it was important to just make this a storytelling session so that you can connect. I'm also Nigerian. I think you can tell from my accent. And I've had a few exposure. You said somebody at that level. I don't want to believe I'm at that level. I think I'm also still working my way up there. But nonetheless, I think I've had a few exposure that I feel I could share some experiences. My journey in global health generally began in medical school as a medical student. It began because of an unfortunate outbreak and a fortunate curiosity, I would say. During the cholera outbreak in Nigeria in 2022, at that time, we were in a 500 level. We had at the time infectious disease posting, which I was part of. We had a class, and I think the lecturer just asked how many death cases from cholera so far, and that sparked the whole conversation in the class. And then the next question was that can we as medical students actually support the Ministry of Health in responding to the outbreak? At that time, there was some outbreaks in Ekiti, and then there were some deaths. And I would say that question was one very important question, the real curiosity and where it all started. And then the consultants, we call them consultants or our lecturers. So that's the way we call them. So he asked if anybody was willing to reach out to NCDC based on that question. And I drafted a proposal and I sent to the DG NCDC at the time of an interest to mobilize, pre-service youth to respond to outbreaks within our state. I would say that email eventually evolved into what we now call the Africa Public Health Student Network Initiative, because from that email, we were able to establish the organization, the youth-led organization in 2022. And then since then, we've been working our way. And during those early days, there were no annual Africa PHSM conferences, no recognition. I believe just spreadsheets, learning the ropes, drafting strategic documents. It was boring, but it was a lot of work. It was boring, but it all paid off. And then you tend to understand that youth engagement really can sound glamorous until you realize that it's actually something you need to be ready to work for. And it has no sense of entitlement to it. You have to be prepared to be engaged. But before I continue, I would like to ask one question. Is there anybody here who have actually engaged in any project in public health? And what thematic area did you engage in? Is it WASH? Is it, because I think I just shared that mine was in disease outbreak prevention. If you've had any project you've worked on around WASH, AMR, you can share in the chat. I want this to be as interactive as possible. Let us know, and then from there, one person or two people might see that they work in the same area, in the same field or thematic area. And then that's where the network may start from. You build a network around a particular topic or thematic area that you're interested in, and then you never know where that can go. And also the other question also is, while you also draw or share the thematic area you work in, it's also important to note that you need to build technical skills required to sit in decision-making tables in those very areas that you are interested in working in. Because one of the first major insights I learned is that global health is not driven by passion alone. It's also driven by competence, and then you have to also be competent in the work you are trying to do. So today, I'm currently serving as a member of the WHO Youth Council, which I'm honored and privileged to be in. And then you also realize that, which is also humbling, that the room respects preparation more than age. You can be young and credible, but you can also be young and ignored. The difference really is in the depth of knowledge that you have, the amount of skills, the amount of preparation that you've put into, being on those platforms. And it isn't a platform where if you are in, you wouldn't be noticed whether you participate or not. It's important to know that the preparation, competence, ability to plan your schedule, because while you are there being a member of the council, you also have your life going for you. So you wouldn't want to be in a situation where you're not contributing so much as possible. I work as a medical doctor, but I also sit on that platform, and I also sit on other platforms as well. But it's very important to understand how to coordinate your time so you can contribute much more effectively to these platforms. So I would also move on to some truths. I think I've shared a little bit of journey, but I also share some level of truth. And one of those truths is many young people want to join public health because they want to sit on international platform first and foremost. They want to be seen, on the big platform. It's great, it's aspirational. But building a career in global health usually, like I said, starts with one curiosity. What area are you interested in? That's the first question. Some people reach out, I want to, I want to be in WHO, I want to be in UNICEF, and then you ask what part of public health or global health are you interested in? And they said, which one would you recommend? I think that's the wrong way to go about it. You need to have, because every aspect of public health is very important, and then you have so much to contribute. There's no shortage of contributions that can go into any area of public health or global health generally. So it starts with that curiosity. Which area are you interested in? Then what competence do you need to build in that area for you to also sound smart when you speak about those topics? And then what contribution do you want to, add to that area? And then how do you build credibility in that space? And that's the way you actually go. And that's the way you actually build a career path in global health or in public health generally. There's also another truth that we usually do not discuss, particularly because people always like to put it off, but because we are Nigerians, it's also important for me to mention this. Global health and public health can be political. It is not wrong for it to be political. The budgets are political, surveillance system is political, outbreak reporting is political. You need to also understand, you want to understand that for you to build a career within this space, you must understand policy, you must understand financing, you must understand diplomacy. You don't just need to understand technical aspects of public health or global health. You must also understand those key areas within the global health or public health space. You must be able to quickly grasp who is funding what project, because I've seen so many comments about working in antimicrobial resistance, working in WASH, working in this and that. You must first identify who funds what program, who approves what policy, who benefits from the interventions that are done in this space, and who resists it. You need to understand that for the most part, if you say you want to address access to water, sanitation, and hygiene, and then you ask yourself, for so many years, why don't everyone have access to clean water, sanitation, and hygiene? It's important to understand that there are some political interactions that prevent certain things, wheels from turning the way it should turn, because policies mostly, for the most part, are swayed in one direction or the other. So for you to really make an impact, you also need to understand how to navigate those policies, navigate diplomacy, and understand that most effective young leaders are those that understand, incentives and how to drive those incentives. So that's also another truth, which I think I should leave here with you guys. And then the last truth I would like to add on to that is that you can't see the end of your direction from where you stand. You want to be on global health decision-making tables. You can't see the end of that from just standing in one place. You have to move. You have to take the first step, and you keep going. Which means the question shouldn't be, Maiwa, how can I be deciding with the DG tomorrow? That shouldn't be your first question, because those things are, they're exciting, but you can't just jump there. You have to make some deliberate effort in that direction, and then you would be able to achieve that. And then I would say I'll be summarizing now, just to make sure that I don't take too much of time. I will be summarizing my journey, because it's important to, as I share all of these insights, I don't make you guys lose the notion that I'm also still learning. And it's important to also understand that that's the very interesting part about global health. Nobody knows it all. If we knew it all, I don't think we would have one disease existing in the world right now. So even the experts are still learning, they're still building on that. And you also need to remember that youth engagement, which we are all talking about, is not about finding the youngest person to bring to the room, really. It's not just about like looking for the youngest person and saying, oh, this is a young person, let's add him to the room, this is youth engagement. It is really about bringing the competent voices within this generation to the table and having those competent voices contribute to the solution. And if you see youth engagement as that, because from the other end of the older generation, they see the need for young people to sit on the table. From our end as the younger generation, we need to see the need for us to be competent enough to contribute solutions to the current happening in the global space. And if we meet in the middle, where the doors are opening, because the doors are really opening at this time, and we also are ready and prepared for when that door open. I think it would be a great match. And that is where, and that is how some of us are leading our path within the journey of global health, within the journey of public health, as we are all still learning. And I would say that is just a brief that I'm able to share with you guys today. I hope it was helpful. I hope I was able to contribute. I know some people already would have had engagement with me at one point or the other, through various platforms like they shared. I currently, in addition to being on the WHO Youth Council, I also sit on the EU Youth Sounding Board for Nigeria and ECOWAS, and the Generation Unlimited UNICEF Task Force, and some other platforms. So thank you guys for having me. I hope I was able to contribute to this very great session. And I want to send my regards to the planning team, Farida. I think we've exchanged some couple emails and correspondence along the way, and every other person that made this a very major success. Thank you. And I will be handing over now to the moderator. Thank you so much.
Thank you very much, Mayowa, for your insights. A few things that stayed with me were, one, when it comes to choosing a career path in global health and public health, it's important to be intentional right from the beginning. Another one is when you spoke about youth engagements. Youth engagements really is about preparedness. So it's important to be prepared to do the work, because preparedness is valued much more than age. And finally, it's important to understand the different aspects of public and global health, especially the politics and financing. These are non-negotiable aspects of public and global health. Up next, we will be having our Q&A session. I would like to remind us participants to drop any questions we have in the dedicated Q&A section. It is from there we'll be reading out questions to our speakers, and we'll try as much as possible to attend to questions, all the questions. Additionally, where possible, our speakers will try to respond to these questions one-on-one. So please keep an eye on the Q&A for when our speakers do that. With that being said, I would be reading out the very first question. And so this question asks, how do I volunteer in the WHO as a final year student?
Yeah, I can take the question. The volunteer program, although there is a link on the WHO website that I shared in the chat, I've been sharing some things in the chat. It is mostly actually linked to the UN program. I haven't actually I haven't personally met volunteers within WHO. I know it's a program that exists within the UN, and it is on the link that I put in the chat on talent programs. I just wanted to add quickly, there's a few things that I've come across in the Q&A while I was going through them about internship, the internship program. The internship program actually has been on hold. WHO is in a very challenging time at the moment. You all know that we have gone from 194 to 103 member states, and with a very reduced budget. We used to have with a very reduced budget, which means that there's a lot of staff that have actually lost their jobs, and it's quite a large percentage. So it basically means, for this reason also, the internship program has been on hold, and hopefully we're going to open it very soon. But we are really working hard to bring more capacity building opportunities for young people to WHO, whether it is the internship program is one, the other one is the youth fellowship program, which has not been launched yet. The other thing that I wanted to say as well is what I mentioned is youth engagement. It doesn't necessarily mean that you will be coming to Geneva one day. Faridat, who I've put connected with people within WHO, because we work in countries, we work in communities, we want to make a change in communities. And there's no better way than actually working with young people like you in communities that actually know exactly what is needed, and that you can champion some of the initiatives that we are working on at WHO. Yesterday on the call, we had specifically excellent questions around polio, and my colleague Oliver immediately said to me, it would be great to connect with the youth organizations that are on this call, because some of the areas, the regions that were mentioned, this is exactly where we actually would need to connect with young people and with youth organizations. So there's different ways of engaging. And so I just wanted to say that, and I have already put Farida in contact with a department that's working on a vaccine literacy toolkit. So there are different ways. But I agree with Mayowa. We have to be very honest. It is a difficult time right now at WHO with a lot of people leaving the organization. So we're going to need some time to be able to open up again and start capacity building of young people from all over the world. Do you want to go to
Thank
the
you so
next
much,
question?
Doreen. Yeah, sure. Thank you so much, Doreen, for those insights. So for the next question, so this person is a two-in-one question, and I think it's more for Myowa. So what part of medicine, I think what specialty of medicine do you think can go in line with global health? And does practicing as a doctor clash with your work and your passion for global and public health? If Doreen also has some insights, you can also answer, please.
Thank you. So I would say it's not an easy combination. So I'm in clinical medicine, and because working in global health space can be a full-time job. And at this stage, because for the most part, our engagement very much temporary. Like Doreen mentioned, the youth council position is a 2-year term position. So you try as much as possible to balance it out. So what aspect of clinical medicine can you combine with global health? I would say community medicine. But although I'm not in community medicine, I'm in general surgery at the moment, which is the surgical unit. But it's not easy. I'm still at work just to make sure I can meet up with this. And if I was on night shift, I don't think I'll be able to join this call. But it fell at the right time. So it's just about time planning. So I wouldn't say there's one specific medical department that would allow you, be able to verge into global health full time, and then you be a clinician full time. So eventually you'd have to pick one, which I would pick one as well, because that's the only way you can really make maximum impact in what you're trying to do. I would say I think that's the best response, just drawing from my own experience, I would say. So you can't really do full time of both. But for now, if you are on a part-time journey, working within the global health space, contributing, delivering on some projects, you can do that while having a job as a medical doctor, or while having a job in any other space or field that you work in, and then try to balance it. But really, to give as much impact and contribute, I think you would eventually have to pick one, depending on where your passion actually leads. So that's the best response I could come up with right now. Thank you.
Maybe I can just add to that as well, and it will respond to some of the questions. WHO doesn't just have medical doctors or public health specialists that work at WHO. At WHO, there's an incredible vast number of people with different experiences and coming from different disciplines. And that can range from obviously medical doctors, more science background, to international relations. We have a lot of lawyers working at WHO. We have economists, we have psychologists, we have people with social sciences background, we have people that are anthropologists, we have economists, we have people with finance background, with HR background, we have there's so many pharmacists, there's so many different people from different skill sets that actually work at WHO. So I just wanted to put that out there so people don't think that you just need a medical background. Communications, also a huge skill. communications. Just wanted to put that out there. Including statistics. One of the questions is about medical statistics. We have a huge statistical department.
All right. Thank you very much, Doreen, for clarifying. This next question is how is the World Health Organization creating pathways for young African medical students to use creative tools like writing, digital storytelling, and media to advance public health advocacy?
That's a very good question. I don't know specifically about any specific initiatives related to certain countries. Storytelling is a big thing today. Working with digital health and AI is also a big thing, and we have a digital health department at WHO. Just trying to get back to the question here. It's all the way on top. Let me just see if I can get the question back up again. So typically, to learn those skills, this is not something that WHO would do. When we bring people in, for example, in our communications team, which is quite a large team, there will definitely bring people in with this kind of skill set and to use this kind of skill set. But specifically doing that kind of capacity building, not necessarily, but it is very much part of the communication approach that we have within WHO.
Okay, thank you, Doreen. Before I move on to the next question, I just want to remind us that the engagement forms 1 and 2 have been put on the chat, so please don't miss any of them. Please ensure to fill them in. Okay, so for the next question, this person is asking, how do I stand out in order to get chosen for these opportunities? Do I have to be a president of an NGO like Dr. Mayowa is? And it seems like there are many, NGOs doing the same thing. Like, how do you stand out? Yes.
That is a really good question. Mayowa, do you want to have a go at it? I think the first word that comes out in my mind is passion, but also experience, voluntary experience, specific community experience. But I think passion is a big thing. Mayowa, is there anything you wanted to add?
Yeah, I would say passion is one, competence is the other. You don't have to be the president of any organization. In fact, I would say at this point within the WHO Youth Council, there are some very key organizations that contribute to that. One is the IFMSA, one is the IPSF. These are organizations that have some very key engagement with WHO. They are also, I would say accredited organizations even for major activities or events like the World Health Assembly. Now, the people that represent those organizations within the Youth Council are not people who are the founders of the IFMSA or the founders of IPSF. And I know any medical student here can easily be a member of IFMSA. You just have to work and show some level of passion and competence to get to the point where, they see you worthy of, engaging. And when I say worthiness, it's not a derogatory term. It's from you actually working and showing that you are really interested in this space. And then you would eventually be a person that represents those organizations, those spaces. So that's just an example just to show that you don't necessarily need to be a founder of some sort to be on those bodies. But, your passion, your interest, your competence, and your willingness to also take those very brilliant initiatives, I think those are something that can help you in making your way and contributing to those very important decision-making tables. Thank you.
All right, thank you, Mayowa, for addressing the question. The next, I would quickly like to address this question directly because Doreen spoke extensively about this over yesterday and today. So this question is about a law student or graduate is asking whether or not they can apply for roles in public health and public safety because most lawyers do not engage in health, but this person believes it will be a step up for them. So, in answering this question, Doreen had earlier stated that the WHO accepts people and students from a variety of disciplines, including anthropologists, lawyers, statisticians, and so on. So, yes, definitely, you could join the WHO as a lawyer, or rather, a student from any other discipline, and that doesn't really matter because the WHO is open, very open actually, to diversity and inclusion. So this next question is directed at both Mayowa and Doreen. It's actually three questions in one. So we'll try to address each part as fast as we can. The first part is directed at Mayowa, and the question goes, could you share practical steps um, on how a person who's just completing their NYC can start and lead a youth-led organization? The second part of the question is also directed at Mayowa and states, could you recommend global health platforms or programs where I can develop technical skills to contribute meaningfully to the field? And this last part is directed at Doreen. It goes, as a young person passionate about polio eradication, what would be the best way to get involved with the WHO Youth Council and actively contribute to the cause? So, Mayawa, you have the floor.
Yeah. So I'm going to start, maybe pick from the second one. Somebody interested in polio, and how do you contribute to that? I think there are very easy way out that I can recommend. First, polio is heavily funded in Nigeria. So you being Nigerian and you being interested in polio, there's like a pathway that I could share, which I believe may help, just practical pathway. So one of the biggest funding partner for polio eradication in Nigeria is the Bill and Melinda Gates Foundation. And they don't implement the programs. They have implementing partners within the country that help implement this program. Their program around polio eradication. I think WHO is one of them, but there are also Nigerian-based NGOs and agencies that actually engage in this space, from NCDC to other NGOs. If you check online, you will be able to see how how Bill and Melinda Gates distribute their fundings to these NGOs for these projects and programs. An easy way out is for you to actually apply for an internship or apply for like an attachment in those NGOs. Now, you can go into those spaces, not necessarily looking for a paid, internship or attachment, but also trying to lobby for paid one are also very beneficial because you never can know what you get until you ask, right? So that's a way you can actually get your foot in the door when it comes to polio. And if you show some level of competence, some level of, because at the end of the day, even in addition to being very good at what you do, understanding diplomacy, understanding how to network is important. So being an attaché at one of these NGO, you can make friends with, with the director of one of the program, or with one of the DG or the likes, and then get a way for it to become a permanent staff, within that organization. So this is a practical direction for you to go if you really are interested in polio eradication, because it's an heavy issue here, particularly in the northern part of Nigeria. It's something that is heavily, being pushed for eradication. We achieved, almost zero case, but there's still a lot to keep that number at 0. So I would say that is the way you could go about it. When the second question, or the first question now, which was regarding starting an organization of your own while doing NYC, you can start organizations anytime. Now, and then I don't want to seem like I'm speaking from a privileged point of view, but to be very frank, I think it's just about taking the first step. If you want to start an organization, have you registered the company? CAC registration is 3 days, because I just registered another one very recently. So, and also trying to look at what you're trying to, build. Is it something that is practically going to solve the problem, starting with your community, or maybe with your state, or maybe with maybe the region, maybe Southwest, or North Central, or whichever region within Nigeria you are in. Would it practically solve a problem? And if it's going to solve a problem at that level, then you can now think about scaling, because I don't want to also give you the impression that it's easier to go, continental, but building something that really serves the purpose within the nucleus that you find yourself would be the first ingredient for you to scale, and for you to have a global, or a continental wide, or continentally recognized agency. So it's about solving the problem. So if you have that, and you have those necessary criteria, then I think just register the company, find your friends, 2 people, 3 people. And that's the importance of also sharing which aspect of public health you're interested in the comment section. See 5 people, 2 people, 3 people that are interested in the same topic as you, and you can start something. There's no shortage of contribution. You can see there's enough NGOs, and there's enough agencies, and there's enough youth bodies. We also need more people within their communities solving problems, providing youth-led solutions. So we can't have enough of that. And that, I would say, that's the way to go about it. And register it, let it be recognized. There are also very much seed grants that also exist. Like I said, the doors are opening for youth engagement, but you need to be competent to receive those opportunities. So there's a lot of seed grants funding for youth-led organizations focused on different areas, whether green initiative, whether public health initiative, and whether social entrepreneurship, or entrepreneurship generally. So if you're able to build that, register, have 1 or 2 competent people, then you can just wait and try to put in for a grant funding, and then you may get it, while also trying to show proof of implications and impact within your communities. I think that's the way you can go about it. So I'm trying to be as practical as possible, because I know these are all Nigerians. We need to live in the reality of the space where we are. I mean, the country as well. So that's a practical way I feel you can go about it, and I hope it was helpful. Thank you.
Can I just maybe add to this regarding the polio eradication and the interest, is to link up to connect with Faridat, who I've connected actually with our polio eradication program at WHO. Just wanted to say I've put actually the youth initiatives in the chat for everybody to see, as well as a website with jobs at the United Nations, including WHO, everywhere in the world, including Nigeria. So have a look at that as well. You'll see jobs in our country offices, but across UN organizations wide. There's a lot of information on there.
Yeah, I think just to add to Doreen's point, WHO really also, and various UN bodies also share so many opportunities, and you should take, I think, the points which she shared regarding connecting with Farida, since there's already a link for you guys to have access to those opportunities. Those are very key ways you can also penetrate into the system and this space as well. Yeah, thank you.
Thank you so much, Doreen and Iowa. So we're taking our last two questions right now. So the first question I'm going to read out is this person is asking what's on my LinkedIn profile can help me to, be noticed by opportunities, like, or if I apply for opportunities, what online profile can I have that can help me stand out or maybe and help me get chosen for opportunities? And the second question is, how do African youth-led organizations, like what steps can they take to align with the WHO SDSN initiative?
So the first one, that's going to be a little bit more complicated to respond. I think if you take a good example of take Mayoa's LinkedIn page. Have a look at LinkedIn page of Mayoa and see how he's constructed his LinkedIn page and see if that helps by providing some structure to it. But I think most important is as well that you connect with the people that are like-minded, that have the similar interests like you, organizations. So you follow them and you see what is happening within the organizations. For example, we have the UN Youth Office that actually have a lot of opportunities for young people to join in initiatives, ambassadorships, but other programs as well, to follow these programs. So, but yes, you need to build a good LinkedIn profile in order, because that's the first thing where people will go. But I think is pick out a good profile and see how that has been structured and try to do something alongside of that.
Okay, for the second question, it was what practical steps can African youth-led organizations take to align with the WHO SDSN initiative?
I didn't hear the last part, sorry. With the WHO?
SDSN initiative.
The youth, our youth initiatives?
Yes.
Okay. I think, how can I say, the Youth Council is gonna, this summer, the Youth Council is gonna open up again for new members. So I think one of the things what would be really important is to look out on our website when the call will be open. We work on many different issues. The Youth Council works on many different issues and many different topics. It can be non-communicable diseases, it can be climate change, it can be education and health literacy, equity. So to align with there's just so many things that organization can align with. We're also looking for non-health organization. We're not just looking for people that are actually all knowledgeable about health and public health. We're also looking for organizations that are non-health related. So when we open our call, as well as health and non-health related youth organizations can apply. But it needs to have a large reach. It's not something like local youth organizations we would not necessarily take. But like Mayoa is coming from a much bigger initiative with African public health students. It's a large continent, so it was very important for us to have that initiative represented in the Youth Council. So it's organizations with a large regional spread or a global spread. And topic-wise, to be part of the Youth Council, as long as it's an organization that has a legal status, that is really important. It has to be an established NGO. And yeah, the call is open for expression of interest, and it just needs to be, when the response is given, it needs to be a good and well formulated response.
Thank you, Doreen. So I hope that has answered that person's question. And that will be it for now for the Q&A session. Thank you for all your questions. It was very engaging. And to wrap the Q&A session up, we want to leave you with one final thought from Doreen. She was very instrumental in ensuring this initiative, was a reality. So we'd like to hear some closing remarks from her.
What am I going to leave with you? What I would like to leave with you, and I say this with a very optimistic tone, things are not always easy. Even even working within WHO, I have my struggles and my challenges in order to push things through that I think are very important. So you need a lot of resilience. I think you need to be creative. I think don't limit yourself. And when you are in difficult environments, these environments are very often those environments that shape you, that make you creative, that make you find ways to make things happen. So I think when we are talking about WHO or the UN, yes, it's not necessarily easy to come into those spaces, but there are other spaces as well where your voices can be heard. So don't think necessarily that WHO is the only place. But I think the most important thing is be passionate. Keep that passion. I think passion drives so many things. Passion drives you through a lot of obstacles. Even though I'm old and I'm close to retirement, I believe I'm still a very passionate people. I'm very passionate about young people and their space, their well-deserved space in global health. And with passion, you can actually make things, you can push things, you can actually push barriers and make a difference. I think that's what I would like to leave with you.
All right. Thank you very much, Doreen, for your closing remarks. And we also thank you very much, Mayowa, for making the time out to speak with us. On that note, we are near the end of this session, and I will be calling on our next speaker to give us a brief closing address in the person of Oluwatobi Loba, who is the Deputy Network Coordinator at SDSN Youth Nigeria. Oluwatobi Loba, you have the floor.
Is it over to Mayowa?
No, I think it's Toby, somebody there.
Hello.
Hello.
Apologies, everyone. Prior to the Mr. Oluwatobilab already informed us that he told me that he was not going to be able to make it, so I am going to be giving an address on his behalf. Good evening, everyone. Thank you so much for joining the two-day webinar. I know that many of us are it's usually after school, and some of us are fasting, but you still showed up and you showed out. Thank you very much for doing that. So I'll be speaking on behalf of SDSN UN, SDSN Youth Nigeria, Kunst Global, and the Global Health and Development Alliance, which is our global health arm, which we created for events like this. So basically, we'll be having more and more training such as this, so be on the lookout for that. I'd first like to start by saying a very big thank you to the World Health Organization, the World Health Organization Youth Council. Mr. Mayowa, thank you for being here. Thank you for taking your time to address all the questions. And I want to give a very extra special thank you. And I would like everyone in the comment section to give a reaction. I need reactions, claps. I need to appreciate Ms. Doreen Vanderwall. Thank you so much. Thank you, thank you, thank you. It is really difficult to find adults that really genuinely care about young people, and you do, and it shows, and we appreciate you. We genuinely do. Your contributions have been valuable. She has been phenomenal. I would very quickly, I know everyone wants to go, but I need to share this story. So how I met Miss Doreen, I was actually stuck. So it was my first time. Imagine, I don't know if you guys have ever watched, Miss Doreen might not know this, but for those of us in Nigeria, we know Sophia in London. So there's this Nigerian movie about a guy that went abroad for the first time, and I was and he was very naive and doing things weirdly. That was me when I first went to Geneva a few months ago. I was outside and I think I came a bit late, as a Nigerian always does, but I was actually stuck outside. Most people were the event had started, so I couldn't really access the internet. This is WHO headquarters. It was very scary for me, and luckily for me, there was an angel that just came in. I was like, "Who is this woman?" She just came and said, "Oh my God, I'm so sorry. Come in, come in, come in." And she let me in. We were about 3 or 4. Let us in. She was so kind. I felt like it was a scam because I was like, who is this nice woman? How nice can you be that you just let me in and then even be apologizing to me for being late? So she actually let me in and everything, you know, she, when I even sat down, she came in after the webinar, after the program. She came in and she was like, "I hope you enjoyed it. I'm so sorry once again." After that, we also met on the last day. You won't believe that this woman even came to me on that last day. She came to me to come and say, "I hope you enjoyed the program." She remembered my name and everything. And then that was when we sort of birthed the idea of this, training. And I think for an amazing woman, we truly appreciate you. And we would continue to, appreciate you for your efforts. And Mr. Bill Yotiv, who was in charge of the World Global Model United Nations, is also the World Federation of United Nations Associations. I think he's in charge of academics. These two amazing humans on that day were crying as they were giving their closing speech. Please, I don't know. For us Nigerians, we know how our lecturers are. We know how our teachers are. Just for 4 days, and they were so kind and attached and loving. It was as if we had another set of parents in a different country. So you can imagine, these are people that we look at as like inaccessible, inaccessible, far from us. But these people are actually so genuine, so caring, and so willing to involve us in everything that they do. So thank you so much, Ms. Doreen. I need more emojis. I need more appreciation for her. Thank you, Ms. Doreen. And Mr. Mayowa, thank you for representing us. To have a Nigerian, I remember the first time I saw you as well. I was so proud. I was so proud of you. I was like, who is this man? And you're just doing amazingly. Well done. And we truly appreciate you for all that you do on behalf of Nigerian youth. We see you. We appreciate you. And I would before I can't go any further without thanking the organizing team. It's been back to back sleepless nights, back to back working, working, working. It's been a lot, and I truly appreciate everyone. I appreciate starting from Ms. Toyin, Mr. Tobiloba, Hamid, our moderators Tosi and Ajibola, that is Fawaz. We also appreciate Fidaus, our tech team, and all the people in her team, Alamin and everyone, Alamin who is in charge of coordinating participants and everyone in his team, and I hope I'm not forgetting anyone, and definitely Covenant Ekarika, who is in charge of our communications team. Thank you to everyone who is in the organizing team and to our amazing participants. You guys are amazing. Our DMs, each of the organizing team members, our direct messages on WhatsApp are filled with messages, questions. I know we weren't able to take so many of your questions, but don't worry, we have you in mind, and we plan to do more and more and more. So just, bear with us and also anticipate. I'd also like to say, because I remember it was mentioned here that LinkedIn, that we need to have an established, each person has to have a very good LinkedIn. So I would like to encourage you to share your experience in this webinar on your LinkedIn as well. That's a way that you can connect with other people. We would also work on maybe a LinkedIn optimization program for you guys. But for now, I think share your experience, let everyone know that you were here, because it's very important. The fact that you were here directly learning from the source. Nigeria WHO is coming to Nigeria, and is coming to Nigeria through you. That is very important. So please make sure you share your experiences. Thank you so much, everyone. And on behalf of Mr. Tobiloba and everyone at SDSN Youth Nigeria, everyone at Cones Global, I'd like to say a very big thank you to everyone. Have a lovely evening and see you next time.
Thank you, Faridat, for making everything work in these 2 days. You've been wonderful. And the connection has been made, and we will keep this connection going. I promise.
Thank you so much, Farida. In as much as Farida is, giving applause to everyone, she also deserves as much, because without her, we would never have been able to do this connection in the first place. So let's all appreciate Farida also. Thank you so much, Farida. You have done a lot for us, organizing this, all the things that we have learned. Thank you so much, Doreen. Thank you, Mayowa. Thank you to the organizing team and everyone else. So we are officially done with the workshop. Thank you all for joining. But before you go, don't forget to fill in the engagement forms. It is important to get your certificate. So we'll leave the session on for another like 20 minutes to help everyone, ensure that they fill the form. So yeah, check the chat box for that. Have a wonderful night, everyone. Goodbye.
Bye.
Bye.
Keep safe.
Bye, everyone.